Good afternoon, everyone, and welcome to this special Gemba 360 legal update around the Stage 3 announcement that has been made in Victoria this morning. This session is a specific session specifically around the impacts that these have for community service organisations, looking at the business practices and operations as we flagged from last Friday. We are going to just slowly go through some of these. There will be the messaging provided in Victoria. We're also going to briefly look at the impacts for agencies that provide services near or across border towns, and also for agencies located in other states and territories, especially up the east coast of Australia, where there are other announcements made by the relevant premiers for New South Wales and also Queensland. Some of the information that we are covering today is also equally relevant and applicable to other states at this point. Certainly some of those covering leases and for residential and commercial services as well. That said, as always, we will be sending out regular updates to agencies around these. This includes also the follow-ups where these sessions are recorded all the way up to the Q&A session where we open up the phone lines, and happy to stay on the line and answer any questions that people might have. With those, I'm joined by a number of staff today from our support desk as well too, that has been ramped up in order to provide support services directly to the health and community sector, especially not just the legal side, but also covering obviously our Gemba 360, including the disaster management works as well too, especially around policies and updates that agencies require. So let's move forwards. As always, we'd like to pay our respects to the elders past and present upon the land on which we all meet. While this session is being run by webinar, we do pay our respects to the traditional owners from where you all join us today. So as I mentioned, this morning, Victoria did announce that it is going to Stage 3. With this was pending from and was flagged last week already that we would move to this stage as well too. So what does this mean? If you haven't already seen the news, let's just clarify some of these this positioning. Effectively, the message is quite clear: stay at home unless you are required to do so for 4 specific reasons. The ban is, there is a ban that's effectively coming into effect at midnight tonight. With it, it means that there are on-the-spot fines of gatherings for more than 2 people. What is important around this is that we do need to, as identified, the reason for this was to protect people's health and well-being, protect the health system, and obviously this is the work that covers the community services directives as well too, where all of you are based within, and also protect jobs. And this is the messaging coming directly from the Premier's office as well. Now, the 4 main reasons which will flow into some of your business practices is the reasoning to leave home is to get medical care, to go to work, where work and study if you can't work or learn remotely, and we'll come to that for yourselves, for your daily exercise, and to buy the things you need when you need them. And this doesn't include window shopping, but this is really around the essential supplies that you would need from the shops directly. These will be made as the directive and news announcement emerged this morning. These will be made from midnight tonight, but obviously putting in policies and practices and informing staff around this will also be important for your agency as well too. There will also be variations between states, other states and territories in terms of what this messaging and what Stage 3 might look like for them. And quite simply, the reason for this is due to the range of prevalence in the coronavirus in each different state and territory. And quite rightly so, as the Premier pointed out this morning, equally what's happening in the Northern Territory may not be, obviously is not relevant to what's happening down in Victoria, and likewise can be said across different states as well too. Now in this case, we will be providing for each of you where you are, or your catchment area spans a number of states, will actually provide you with specific legal updates around what this means for you. There are a number of community service organisations that equally span a number of states, and you will get all of the different coverage and information. Equally, if you're solely based in one state, then obviously we'll keep it relevant to yourselves, and you won't get this cross messaging coming through to avoid any confusion as well. In this case, because the stage 3 is coming into effect, we have opened up this webinar especially so that other agencies can start to get insight into preempting where their states will go as well too. And I think that's important to do, because some of these 4 points about the reasons that you would actually leave home for staff is actually very, very broad and quite relevant to yourselves where you're sitting at the moment. But effectively, there are 4 reasons to leave home. One is to get medical care. The second is to go to work and study if you can't work or learn remotely. The third is for your daily exercise. And the fourth is to buy things you need when you need them. And this obviously doesn't include window shopping. So with it, we just need to cover off what the stage 3 restrictions that will be in effect from midnight tonight, what this actually means, what this covers, and what the fines are. Because we need to cover this off specifically for you, because this will impact in some of the policy decisions that you will need to have in place. And we were asked a couple of questions last week as well too, one of which specifically being what happens if you're in a building and you're working, providing community services, where another shared tenant may not be following these guidelines. And so this is why we need to cover off some of these things. So as agreed from National Cabinet, gatherings will be restricted to no more than 2 people, except for members of your immediate household and for work or education. Now, under stage 3 restrictions, the new directions will mean that what was previously general advice about staying at home will now become enforceable as well too. Playgrounds, skate parks, outdoor gyms will also close, and specifically for agencies like yourselves where you might be doing outreach work, group services that may involve attending such premises will be excluded as part of this because they will be closed. What you will need to look at is changing what you actually do in terms of providing services. I know that some of these areas might involve some disability service agencies, outdoor trips, etc. These will need to change in terms of the services that you deliver specifically to these particular areas. It doesn't mean that if you can't take people for walks or golf as part of your general exercise, but again, you need to be careful around where those trips actually are, because effectively the fines that can be imposed on people is on the spot fines, and you'll see this down the bottom of the slide. Effectively, therefore, individuals breaching this, it is $1,652 for individuals, and for businesses or corporations, it is $9,913 for businesses, but larger fines can also be issued through the courts as well. Now, these 3 stage restrictions will come into effect from 11:59 tonight, effectively midnight tonight, by 11:59 tonight, and they will be in place for the next 4 weeks and reviewed as required. So for your agencies now, effectively this, I'm going to say, new world of stage 3 restrictions at this present time we are looking for at least a 4-week period for you to plan what and how you're going to run and deliver specific services, and what you'll need to do in terms of managing this for at least the next 4-week period. So one of the questions, just before we go into those, I think 9 or so questions that we raised in our newsletter, was firstly, what does a maximum gathering of 2 people mean? I hate to kind of raise this, but this was something that was put up when people asked, well, what does 2 people actually mean? And I truly would have just thought 1, 2 being 2 people. But again, we need to clarify this, especially where we're talking about services that are being delivered, and obviously how you're going to manage this. So look, we'll cover this now. So based on the advice of the Australian Health Protection Principal Committee, and this is the committee that actually advises the Commonwealth Government, and if you remember one of the first webinars we covered, it's where a lot of the guidelines come from in terms of even the ethical decisions. So all gatherings will be restricted to no more than 2 people, except for members of your household and for work or education purposes. Social distancing rules should also be observed. So with it, again, where it says all gatherings will be restricted to no more than 2 people, except for members of your household and for work and education purposes. Now, the question will come up, and we will discuss this a bit further, is do you as an agency need to follow this 2-person rule even if you're at work as well? And with it, we'll just unpack that a bit more as we come to the questions. But effectively, 2 people is defined as this. In terms of tenancies and impact across other states and territories of Australia. Now, as the health crisis escalates, many Victorians and other people in other states have had significant economic crises as well too. So with this is a new introduction. There's going to be a moratorium on evictions, which will be introduced for the next 6-month period, and this applies across residential and commercial tenants who are experiencing financial distress due to the impact of the coronavirus. And as I say, this actually applies across to all states and territories. Now, many agencies are either providing temporary housing, short-term housing. You may also provide housing and support services, whether it be to disability clients, to aged care services, etc. The list goes on, even for welfare recipients as well too. Now, with this, it is important that this moratorium will be introduced, and it's for a period of 6 months. Now, with it, if you are in the, I want to say, the business of managing houses, or you're a tenant yourselves, and you provide support services on behalf of a third party as well too, you should be aware that this is now open to yourselves and to the clients that you support, especially in a number of agencies and vulnerable communities, being Aboriginal agencies as well too, disability service providers, etc. The 6-month moratorium will be introduced as part of this, and it applies across all states and territories. So it may well be that you need to let your clients know about this as well too, before it becomes an issue, as part of their rights as well, which is important at this point in time, especially for a public health emergency as we are experiencing at this time. In terms of the 2-person rules, the other questions that have been asked is, does this apply to weddings and funerals? And no, the rules for weddings and funerals remain. No more than 5 people are allowed to attend a wedding. The 2 people getting married, a celebrant and a witness. For funerals, no more than 10 people can attend as the previous directions have allowed. Again, in some agencies, I do suggest that you look at your policy directives around this, especially where you yourselves may provide aged care services and also other end-of-life services as well too. Specifically for funerals, where often the community may get involved, we have already started having conversations with a number of aged care facilities, and this is an unfortunate but important discussion to have. With this, if there are 10 people that can only attend in this circumstance, again, we are having to support agencies in having some sort of advanced directive being provided, because it may well be something to consider, be it carefully, and the timing unfortunately may come where it needs to be provided. So we are suggesting for agencies to start to have some of these conversations. We've actually met with when I say met via teleconference over the weekend as these stage 3 restrictions were starting to come through, to actually have agencies start to consider, especially in some service areas such as aged care services, if it needed to happen, that they may well be required to meet with some of their existing clients to discuss some of these things, like who do they may want to have, and make sure that their relevant powers of attorney and guardianship orders are also up to date. Now, one of the things that you will also need to note is that the police have been given the power to issue on-the-spot fines, both to individual and businesses who refuse or fail to comply with the Chief Health Officer and Deputy Health Officer under these emergency directions. And this is something that we have already just previously covered. With it, this also means that persons and businesses could be fined if they fail to self-isolate for 14 days after arriving at an airport in Victoria or from a flight from overseas as set out under the airport arrivals direction. Or also this covers if they're moving interstate as well too. So there is reciprocal type of agreements that are also in place as well. And so travel policies will equally need to be updated if people are still even doing that as well. Also, if people organise or attend mass gatherings prohibited by the gatherings direction, then again, businesses will be fined. If you organise, again, a wedding or a funeral that has more than 10 persons, then again, you can be fined as well too. So it's for this reason that we're actually informing agencies to actually make sure that they do have some of the discussions, as hard as it may be. You can contact us around that as well too if you need support. Now, some of the questions from an operational area for community service organisations has been these actually 7 or 8 questions. Some of these is, what should agencies do to continue to deliver client services, and how should these change, right through to the privacy and confidentiality, as well as looking at what about group classes, should these continue, what about providing services to some of your vulnerable community members where outreach visits and outreach services are needed. We also know that some agencies are also talking about, or have already commenced, delivering community food boxes and deliveries, and they've asked, can we just pack boxes, or are there food handling protective measures that also need to be considered? There are other questions around, what if we work from a building with other tenants who are not following government directions? And let me just bring this up. And also a few other questions around, what if we have shortages of our staff in facilities? Again, what is the requirements that we have under stage 3? Can we backfill them with people of lesser skills? What's the impact of this? And what are some of the other changes that we should have should further restrictions be introduced? And there has been also talk of, can we introduce clinical governance strategies around this? So with it, what we have done for agencies to assist throughout this process is to actually load into the disaster system the relevant parts of this for you as well too. And I'll just work through each of these questions for you one by one. So under this, you can see we've got the initial stage, and we're up to 2.3, the targeted action stage. And if we open this up, what we have is these specific questions listed, and also looking at workforce areas. So the first one is, what should agencies do to consider to deliver client services, and how should we actually deliver these? So with these, again, there are specific activities that need to be delivered as part of your essential services. We've seen this where agencies need to look at how many people, if you haven't already, can work from home, and most of you have actually set these measures up. Where business processes can change, where phone appointments or Zoom appointments or the likes, video conferencing can be done in place of face-to-face, that is obviously the way to work at the moment. With that said, there are many other services that are face-to-face critical, e.g. aged care services, medical services, where actual assessments need to be done and symptoms measured, etc. Some agencies have taken the point of actually reducing some of their staff around those consultations, but actually mitigating the risk by actually having specific designated workers work through that for them within those facilities. One of the recommendations we are making is that staff do get screened as part of starting each shift. I know a number of agencies have started to do this already in specifically some of the high-risk areas, and it is something that you should consider. In terms of the disaster side, looking at checklists such as this around awareness training, advocacy training, if that's what you need to be doing with staff around this, and also looking at health and well-being of staff around some of their decision-making is also important. With it, the other question that has arisen is, do usual legal obligations exist during this time? For example, privacy and confidentiality. This has come up a few times when we've gone through these sessions. Disclosure of symptoms and information, and if somebody does have present with or test with their test being tested and has a positive test of COVID-19, these obviously get reported back to the relevant department. That said, equally, agencies have raised about privacy and confidentiality of client information when people are working from home. So yes, legal obligations do still exist for staff. You should have by now updated things like your privacy policy. If you haven't, then again, we'd suggest you do that in terms of just mentioning to staff and creating their awareness that the legal obligations and compliance obligations for healthcare, for information that they may now hold as well too, they need to take appropriate steps. It's not simply that you're working from home and everything else gets forgotten about in terms of disclosures and the likes. This is particularly important for community-based organisations, Aboriginal Health Services being one of those, other ones being outreach workers as well too, where a lot of the work at which you do may also require you to disclose information around this. One thing that I will touch on here was we had a agency staff member that was providing outreach work, and part of their role today, in fact, was to actually go and visit a client at their house and actually take them grocery shopping to get their essential foods. And that person was actually uncomfortable because they were unsure of whether that person actually, they knew that they weren't, I'm going to say, compliant with directions provided by the health department under the stay at home. They were actively still in the community, but they want to know what to do. In this type of circumstance, we would actually say, if you're accompanying somebody like this to take them somewhere on their behalf, and it could be to the grocery store or the likes, then try and limit what you actually need to do. And it's something that needs to be enforced not by the individual outreach worker in this case, but also management and policy directives around this. So where possible, in this case, we would suggest that rather than taking the client to the food shops, to actually do their groceries and effectively increasing the contact with the community. In this case, we'd almost suggest to actually get the grocery and then go back and either organize a delivery for the client if that can actually be done. There are some changes around this that really need to be looked at very carefully, because the issue then becomes that if you're trying to protect both the clients and also your staff from actually coming into contact with people that might have COVID-19 as part of their daily contacts. And so what we're trying to do here is follow those 4 specific steps, but looking at what you can actually do to change it from a business practice in terms of how you're running your current agencies if you haven't already. In terms of one of the other questions that we have under this disaster side is around, do group classes continue? And this is an interesting one, because with this part of this, if I just open this up and look at the flowchart of what was recommended here, was again, group classes for agencies simply should be limited. We had discussions with other community health centres around whether the following guidelines are relevant to other business groups, but effectively health and medical health and wellbeing or community services are exempt currently, and whether you should follow those guidelines. Our advice is to follow those guidelines. In terms of the group classes, limit it down to 2 people if you can. Around that, there should be really a legitimate way if you can't do that for any reason, but otherwise remove it from group classes altogether from your agency. Now, if it means that within your, for example, aged care service, that you might be having activities that the residents do, and effectively all the residents and staff, there have been some agencies where staff have actually started to live in with the facility, and so there's no in and out contact. It's even down to they've shut their doors altogether, and literally when I say shut their doors, lock their doors, and the only contact that they now have is through delivery supplies that are delivered to the front door. Their weight, boxes and everything are sprayed down, and then food brought in thereafter. Now, if that's the case, on those extreme circumstances, whether it is effectively prevented, then again, that might be a way that those types of activities can continue. But in saying that, where that isn't the case, then effectively group classes are scrapped down to effectively just a smaller group, as we have seen already. In terms of what about providing services to some of the most vulnerable communities, members of the community, and also I will also just deal with the some of the agencies are talking about food boxes and deliveries, and I'll deal with these 2 points together. For some of the most vulnerable members of the community, again, the essential services that are needed for aged care, for Aboriginal services, for people with a disability, for the elderly as well too. Again, these population groups where those services are being delivered, again, what we're suggesting here, even under stage 3, is to follow those 4 requirements. Where medical services are being delivered, screening staff in and out of their daily jobs is a relevant and important part to do. It also means that you are changing and doing as much as you can at this stage to protect those particular persons. Contact should be limited to regular people providing those contacts as well too. We understand that that may involve a shortage of the current workforce, but at least that way you've got shifts that are happening with it and staff getting relief at that stage as well. The other part that we will just mention is around agencies looking at delivering food boxes. And if I open up this disaster system again and looking at what are some of the activities that you have, and also looking at key milestones and tasks and who's responsible for what. Under this particular area, it depends on what you are actually doing. We know a number of agencies are in fact looking at and have started to actually deliver boxes of essential goods and for specifically community members that can no longer get out or are in self-isolation or have limited contact with the community as well too. On that said, I will just jump back and mention to you that as part of the work that GEMBA does do, there are other agencies that you can leverage off as well. After sending out the message today, I was contacted by Julie Beckers out at Interworks Australia, and one of their agencies, ITFE, does also provide hygienic practices for food safety, has not only policy guidelines, but also online support as well too. So looking at practice methods as well for your agency, depending on what food supplies you are providing. If it is, I'm going to say, picking and packing around or even just getting deliveries and providing fruit boxes, etc. If it's one-off, then that's something different. But if it's ongoing and it's certainly a service that you are providing, certainly over the next 4 weeks to 6 months kind of period, where it is a regular process, we do suggest you actually do look at some of the food guidelines as well too. And we'll send around these PowerPoint slides for you to access. This is the ITFE site if you do wish to actually have a look at this. And they are certainly up and down the East Coast as well too. And they have actually provided, as you can see here, under their own COVID-19 update, which is around the safety and support of participants during this time. And they're working on the latest advice coming out of the Australian Government and Department of Health as well. So if you are providing this, it is available also in the disaster system as a reference point for services. If your agency equally is a source of information, we are happy to circulate that round to the group of agencies as well too. So if you did want to share resources across the community sector, we're happy to actually act as a conduit and share that information resourcing across. But that certainly is another resource that is available to yourselves as well around the food safety and handling. With it, one of the other parts that I will just mention around this, let me just bring these up, is around the the restrictions that you need to consider as if there are further restrictions. No doubt it looks like, based on all the chief medical officers, that there is plans on further restrictions if this curve doesn't flatten out. At this stage, what we are suggesting to agencies is to start to look at your key essential services, look at things like your HR areas, workforce, where staff cannot work because they have been quarantined or self-isolated. Then again, who can actually fill those roles? There are emergency credentialing and scope of practice documents that we have circulated around previously, and we're happy to do that again. It gives you the guidelines from the department on what staff can be utilised in terms of filling a gap if there is a shortage of workforce across your agencies. We would recommend that you start to look at where are the essential parts of the business services, services that can't work from home, but equally what are the strategies to fill that, especially where you have clients that need that direct contact from yourselves. It is something to carefully consider, and this is where we've actually suggested that you look at your clinical governance strategies. We have circulated a previous policy around stage 2 around that for you to actually look at. And again, there are specific emergency qualification guidelines that you can use as part of that process to get either medical workforce, nursing workforce, and other specific workforce staff appropriately registered in order to deliver critical and crucial services as well. One of the last things I will mention is around the guardianship powers of attorney and health directives and wills that need to be considered. One of the major challenges that agencies across a number of catchment areas have spoken to us this weekend is the sheer volume of unfortunately expected deaths that they are forecasting. In some areas, we've heard of guidelines of somewhere between the next 5-week period is where it will balloon. As you can see, many state governments are trying to impose restrictions to stop that happening, which is where and why we've suggested previously that expect further restrictions in order to try and bring down those the prevalence of the COVID-19 cases across each relevant state and territory. One of the areas, and I'm just using this screen to click through to prompt me, was around in some suburbs, not across states, some suburbs and geographical catchment areas, somewhere between 10 to 20 deaths per week if this doesn't get under control. Now, part of this outcome, unfortunately, is that what may need to be considered, and I say may very loosely, but should be starting to consider, is around where there are vulnerable people and communities that you suspect around this, start to have your policies, your procedures in place to look at, or even just audit, do you have the appropriate guardianship orders in place, powers of attorney in place, and wills as well. This is one of the points of our work that we do that I'm going to say has been very difficult for us to speak to agencies about, because these are clients that yourselves might work with. It is work, I'm going to say that on one hand for us and our law firm brings, I'm going to say, little or no joy around having to have these discussions, but we wouldn't be doing our job if we didn't raise this with yourselves. So part of that is that there is the need, if you think that in some areas, and we've heard in some suburbs, that they're expecting a prevalence rate of a few thousand, like 3,000, 4,000 is what they're expecting in some suburbs alone. Even out of that, if this continues, and in some health promotion agencies, they are monitoring it, and their forecast, as I mentioned, is somewhere between 10 to 20 deaths per week, starting around the 5-week mark. So with this, it's a very, very real issue that your agency really needs to carefully consider around this. Looking at, if something happens to one of your clients and you provide services in aged care, if you provide services to Aboriginal clients, if you provide services to other vulnerable communities like disability services, etc., do you have the relevant documents in place? Do you have guardianship orders, power of attorneys? Have you had the directives of the 10 people that may well be asked? Because in some communities, and I've been to some, especially Aboriginal funerals, where it's a community that comes together as respect for an elder. The same thing happens in other areas, but it's nothing like when I'm going to say Aboriginal communities where you can have thousands of people come in. So with it, even down to people's wills as well too, it's an unfortunate discussion, but an important one that you really need to consider. We have put together just a pack for agencies. It is there to almost ask questions around this and what to do covering these areas. It is probably one of the, and I'll quite openly say to all the attendees, it's one of the saddest things that as a law firm we've actually had to draft up, because it's not so, it's something that's done in advance, and not just in advance of something that's actually coming up. So it is something that we've had to do and start to do this weekend as well too for agency that's there, and we can walk you through it. Equally around that is around the, when I also talk of this area, for those of you that run medical services as well, and with it, especially primary healthcare services and GPs, again, if your services are actually overrun and you don't have the staff to actually fulfill even the screening, effectively choosing people to see may also become an issue. That's something that I'll cover off in a separate session, probably something that will be done just on its own, but it is something that other agencies have asked us for advice on over the course of the weekend around what if we are overrun. How do we, what is our legal obligations? What is our ethical obligations? And there's whole issues around euthanasia and the like that come into this as well. So we'll avoid that for today. I'll be running a separate session on that in the next few days. One of the things, I was just coming back to this point around the guardianships and powers of attorney and wills, is it is an important conversation and a delicate conversation that needs to happen, but an important one nonetheless. As I mentioned, some agencies have already started to do this. We raise it that you will need to consider this if you do provide those services and the clients essentially as well. With it, just going back to the slides around this, we do make a number of recommendations. One is aligning your policies and disaster activities with the Commonwealth and state, your relevant state community directions under stage 3. Do plan for further restrictions as things escalate, and the states do try and contain this pandemic to their ability. Update your policies around these 4 areas, and I've mentioned them time and time again. The exceptions to stay at home, with the exception of, the rule is to stay at home, with the exceptions only if you get to get medical care, to go to work or study as outlined here, for daily exercise, and to buy things when you need them, and this doesn't include window shopping at all. As I mentioned, we will be running separate webinars across some of the specific state and territory restrictions as they come out for those agencies that do cover a number of states and catchment areas. You will receive the relevant ones for yourselves. Our newsletters will come out almost daily now. We have ramped up our systems, so we have ramped up our services where we are operating basically 24/7, and agencies have contacted us even late yesterday, even after 11 o'clock, to get legal advice and also work through some complex issues that they don't have time to deal with during the day. I will also add that with these, specifically look at your policies, look at your business processes, look at how you can adopt these stage 3 restrictions in terms of providing the medical care as well too. Look at limiting the face-to-face contacts. I gave you the example of an outreach worker and how they had a client that wanted to go shopping today, and what some of the options actually are. With that, I'm happy to stay on the line. I've got a number of other staff that are joining us to follow any chats that people raise. We will stop the recording here, but if you do have any questions, by all means, please email us at support@gemba360.com, or you can phone us through on 1300 360 360.